as the moderator, I want to thank the panelists, every single one of them on time. Bingo. Bingo. So we have caught up, if I'm not mistaken, and we have about 17, 18 minutes for Q&A, which is wonderful. I'm sure we need more of this. We could use lots of it. So I'm going to move up there only because I can't see hands behind my back.
Margaret, let me start by asking a general question. It seems to me that this issue of the web facilitating communication and access to help and monitoring, et cetera, for individuals with disabilities interacts with a very important aspect of our aging society. It's not clear to me what the answer is, but it's very clear that older people use the web less than younger people, including Clayton's mother, and we heard that story. And that the number of older households that are, quote, wired is very much smaller than that of younger households. Well, one thing we can do is wait, and there'll be a secular change, and that'll change over time, hopefully. But the question I have is whether or not we have information about whether older people with disabilities who are not wired actually can become wired so that they will participate in this monitoring and facilitation of care and everything else that we're talking about, or whether it's hopeless because they're just not going to go there. And whether we have actually any experience on can we get them on the train, and if so, what does it take to do that? So I don't know, that's a general question, Margaret.
I do too. But
Are you guys discussing
you
who's
go
going to
first.
take it? Okay, good.
I think there might be a button there.
We'll start in order of presenter.
I think that's a great question.
You've got a button there. On the top.
Yeah, okay. I think that's a great question. From my perspective, there's a continuum of computer literacy that one shouldn't make assumptions about for any particular generation. And so there are eager adopters, and there are people who are having less access to online access, but anywhere ranging from people who are very novice to very savvy in terms of computer at any age spectrum you look at, I think. And the kind of solutions that Clayton spoke very eloquently of in terms of making the technologies easier to use is critical, and I hope that he'll say even more about that. From my perspective, ensuring that assumptions aren't made, or rather that the right assumptions are made in the technology design is critical as well. So as someone with a disability, for instance, I have needed to go through various complex medical diagnostic procedures, and in some cases been forced into an online registration interface for that. And it's been very interesting to me to note the barriers within those systems. So increasingly, some of the community-based and hospital-based systems for more critical care, for instance, have barriers built in and yet are moving forward rapidly into use of technology entirely for some things that they do. So many of us in this room grew up initially in an environment that was very segregated with regard to disability, where the audience was assumed to be a disability-free audience. And those assumptions, I think, have carried over into technology design. So whether it is the patient gateway for somebody who's trying to access a particular service or the interface for an infusion pump or something where it actually, some of the critical information is on the web, some of the critical information is online. I think that regardless of whether someone is an eager adopter of technology or not, as they age, they'll increasingly need to be using systems where people have put the technology in front of them, and having those be accessibility supported and as friendly interfaces as possible are important pieces of it. You can't get away from it. All the healthcare systems are moving to technology, and so we have to address that for people and make it easy. And it may be that there needs to be more community-based training options for users of technology so that there's supportive services to help orient people to those. But I think ensuring that we're not putting inaccessible interfaces in front of people is a critical part of that.
Clayton, you wanted to speak to it too? Please.
Yeah, great question. I'll say that too. And some subtleties and complexities in it. So on the one hand, as Judy's brought out, I'm sure we can all think of examples, we have a world in which people are going to have to be online, but perhaps paradoxically, that doesn't quite mean they will be. So what's the option? Well, kind of, being left out. Really having significantly lower quality of life, inability to participate in critical functions, death in some cases. So the stakes are high. If you look around the world, there are countries that have made a societal investment in making sure that people are connected. We have not done that. The FCC is taking some small steps in that direction to address the cost challenges that are kind of one of the factors there. But I think there's a serious issue there that the world is developing in a way where people need to be online, and there's a challenge to our society whether we will make it possible for them to be so, or whether we will accept some kind of third-class citizenship for people who are not. So that's one observation.
And I would just say, as a geriatrician who at some point in my career actually took care of older patients, I'm really skeptical. And, it's pretty clear somewhere between 45 and 50% of people over age 80 have cognitive impairment. And come on, guys. The real world, I think it's going to be really hard. But maybe it'll happen.
Well, again, what I try to indicate, there's two parts to this. So if people are online, then there's lots of stuff that can be done, as I tried to suggest, to make it easy for them, whatever their capabilities are. But getting them online is a different kind of challenge. The other point I wanted to make about the secular thing that you point to, well, maybe not. It's been pointed out to me that one of the things we miss is that we kind of think, well, we're all digitally literate nowadays, and when we get older, we won't stop being so. Well, what that leaves out is that the technology that we'll need to cope with when we get older will not be the technology we're used to today. It's going to be something else. You can already see this with the sort of iPad, iOS world replacing Windows and that other kind of stuff that people are familiar with in their corporate workstations. Well, the point is, whatever technology you've adapted to in your workplace, as you move into your 80s, it's going to be different technology that the world is asking you to adapt to, which raises the stakes further for all of this. So, some people have said, well, we won't have to worry about this after this question of simplified access or whatever, because everybody will be used to all of it. Well, they won't be. They won't be used to the new stuff that's coming along. So the need to be able to tailor the presentation of whatever it is we're doing is going to persist.
Just add one point. I'm very glad that you mentioned your skepticism. I really welcome that observation, and I think it's important to address. And actually, Clayton, I think, is been introduced very modestly because he's also one of the experts on cognitive disability and computer usage. And he has been a great help to the web accessibility work that I do at W3C, which we started with a commitment to be very cross-disability, including accessibility support and solution for cognitive disability, including intellectual disability. And I would challenge you to learn more about this area and to look at some of those solutions. And actually, I'm remembering a presentation by Nancy Ward, who has an intellectual disability and very eloquently showed some of the systems she had participated in developing in terms of a Medicaid reference desk, I believe, where I was thinking this is some of the clearest presentation of medical terminology that I've seen, and it had some self-voicing options for different terminology and questions and so forth. And if you look at some of the work that's been done in this area, I think you could see that the ability to support people's independent participation in and engagement with their, various different parts of healthcare system, including as they age, that there's more there than you may guess. And it's possible to, I mean, our guidelines, for instance, include considerations for intellectual disability. And there's quite a lot that can be done there, including with people who are getting newly online as they age, regardless of a combination of disabilities.
Okay, Mark, please.
I think I just had just a brief thought. When we think about can we get older people online and can we get them active, I don't think we need to necessarily keep the same paradigm that you and I may be thinking of. If we can get somebody connected, with a medical device and, maybe gets a phone call or gets a Robotron or whatever, it comes back that there's an issue, that is connected. So, connection means two-way interaction. And, we've got to think about it from a literacy perspective. But, as many years ago, I learned in business that, if you have to kill a fly, don't use a cruise missile if you can use a fly swatter. And sometimes things may just need to be simpler. And to be able to have that interaction and that engagement will be different necessarily for all folks. And we don't need to think of it traditionally as the internet. We need to help people understand how they can do a better job remaining independent and have then an interface or a support or something that can get them there.
Good point. I saw a question over there. Go ahead, please. Please grab a mic from somewhere. And I saw a hand over here. Yes, we'll go to you next, and then.
I was just going to comment on my just personal experience. My in-laws are of a certain age, and I mean, so my family has we've decided to purchase an iPad for my in-laws for the holidays, and so the hook for this is really to use something like FaceTime to have them engage with their grandchildren. So the hook to use the iPad is really, well, you can see your grandchildren, now daily if you want to, but that will give you that experience using the iPad and then apps potentially that can help impact your health. So I think kind of looking at about how these technologies can really, how they might use them in their daily lives. I think that's
Okay.
Well, it seems my skepticism is got attracted a lot of attention, but this is the National Academy of Sciences, right? And so my question is, and I appreciate all these comments. It's not how easy can we make it, how clear are the medical definitions of the medical terms, what kind of an incentive can we use, like getting to your grandchildren. I think that's all really interesting, and I was unaware of that. My simple question is, are there data to indicate that we can, in fact, take this population of older, unwired people and get them wired? I mean, and if there aren't, that's great. We should generate those data and see if we can do it. That's all,
As a moderator, I just want to make a quick comment. We've only got 5 minutes, but I do think I'm going to support your question, Jack. Originally trained as a gerontologist, I think we really do need to know more about and learn more about this area because, with all due respect, equating an 85-year-old or 90-year-old older adult to a younger person with intellectual disability is not the same. It's not the same. It does not present itself the same way. It is not the same. The older adult will perhaps have erratic areas of cognitive deficiency, also visual impairment, hearing impairment, dexterity problems, generalized frailty. It is different, and I don't think it's impossible, but I think you don't have time. We got to go into other questions. I think we don't know enough. We cannot just generalize from our understanding of younger people with a single disability to older people with multiple chronic disabling conditions. There needs to be more knowledge here, so I would just support that. I promised you next turn. You have not asked a question.
Is this on?
Should be.
Yeah. Hi, I'm Arlene Stanton from the Substance Abuse and Mental Health. Okay. Anyway, thank you for that example with suicide. But as far as older people, obviously sometimes cognitive impairment's an issue. But I'm also thinking a lot of people that are in my generation, I mean, they, in my office, they go to me for the computer questions because I've pretty well grown up at a time where I was an office worker and exposed to computers pretty early on, and I was interested in that area, even though it's not really what I do. But what I found with my 87-year-old mother was she originally mocked me when I brought home my tablet, but then whom we called Ralph. And after a while, though, I realized there's sort of the phenomena of the secondary user, and I know a lot of long distance or close by caregivers who are kind of the family person who deals with that. So she was getting to the point where she'd say, could you ask Ralph whatever? It wasn't as important to her at that stage in life, dealing with as much as she was, to become totally conversant in everything computer. And I think sometimes, I don't know what the research on this is, but one thing was I think she was a little more sensitive about privacy concerns. I think I'm more sensitive about it than maybe some folks who are growing up with Facebook in their face. And I think also sometimes with older people, there's a kind of a lack of self-efficacy, and sometimes it's not helped depending on the people around them. You know, if they feel foolish picking it up and maybe fumbling a little, as anyone would if it's new to them.
Thank you for your comments. Yes, Larry.
I have a practical question to ask the three of you. I come out of the provider world, and you've just about convinced me that technology really could be a panacea. And although Jack is very skeptical, I'm saying, you know, we gotta somehow, this can be an integrator, a normalizer, could be very important. So I got a member out there, Our Lady of Perpetual Deficits, who's been around for 150 years. They're converting their nursing homes and they're tearing down old buildings, and they want to serve their community, and they're going to put a $200 million campaign into creating a whole new delivery system for a 5-county area, and they want to do it right. And we know that the technology is changing and emerging. And they say, Larry, what advice could you give me around technology as we make this $200 million investment for the next generation of seniors we're going to be serving? What would you tell me to tell them?
Look for standards-based solutions that take a universal design approach and that support interoperability with some of the specialized assistive technologies that some of the people may need. And with regard to web, there are solutions there, and we will continue to advance those. And it can be surprising the many different places where the web is part of what's involved in making an infrastructure work and a service delivery system work. So that actually helps many areas of the work. But there are many people who spoke this morning or hallway conversation, I know standards that in a number of different areas that could support that. I wanted to briefly clarify that I was not equating cognitive disability with aging, but rather saying that one needs to look in a very cross-disability way across the needs regardless of someone's age. And cognitive disability is not excluded when one looks at technical solutions. And as people age, one needs to look at a multiplicity of disabilities.
Clayton, your mother's going to live there, so I got to figure out how to serve her. What would you tell me to tell Our Lady of Perpetual Deficits?
Go talk to Greg Wellams is the first thing. But then something else, and others in the room may know more about this. I mean, the obvious thing that people think about today is wiring. But I think there's reason to think that that may not be the right investment to make now. So I'm hearing that there are now ways to use wireless much more comprehensively. But the reason I say first talk to Greg is that Greg might say, "Yeah, the wireless stuff is fine, but it isn't going to do your door openers or whatever it might be." So it is a technical question that I'm not equipped to answer. But I would echo and maybe reinforce what Judy has just said. It really is important to do this stuff in an open way, and to avoid buying into solutions that are somehow old people specific, and instead equip your facility to allow the old people to participate in the mainstream activities that everybody else is participating in. Because that's really the driver for this stuff, is that this is how people are living now, and if old people can't live that way in the future, it's going to be bad.
Mark, feel free to suggest an Oracle solution if you.
No, I would only suggest something that's open that's interoperable, standards-based, and if it happens to be Oracle, that's okay too. But, I would challenge your theoretic institution to not think about the next 20 years, because the fact remains that many of the revenue cycle solutions that are in the market today are 45 years old. So if healthcare continues to get any more cost-effective and less efficient, or you have the financial woes, which I anticipate will be there with more desired access, you're going to need to think about anything that can be a platform that will be non-proprietary, that will give you the ability of being interoperable, not only from a software point of view to where multiple softwares could work together, but also from a device point of view, because there's a big thrust now for bring your own device. And if you want to use your own iPad, your Mac, your whatever, you should have the ability of doing that. So think of it in terms of standards-based and interoperable, but then think of it in terms of developing a platform that will spur innovation. Because I will promise you that you don't know what the needs are going to be in 10 years, 15 years, or 20 years. And if you have a standards-based system that can bring data in together and create let's call it big data type of solutions or innovations from it, you need to make sure that it does actually work together. So think of a platform approach versus necessarily a product approach, and think of it as a strategy that's open.
And I can tell them that just what you just told me is help to do that is available today.
Everything you need to do that is available today, and it will only get better.
Thank you.
I think we're going to have to.
Please join me in thanking the panel again. And
So we will take a 10-minute break and come back, but at the same time, you should all know we're going to be ending on time, because we built in a little extra time at the end for Al and I, which we will waive. So, 10 minutes.